Good morning. We will continue on infectious diseases. Chlamydia trachomatis. Usually it is asymptomatic, but it can present with dysuria, for example, postcoital bleed. Examination typically normal, but also we can find, for example, specific appearance like cobblestone appearance on cervix exam. Also it can cause vaginal discharge. Nucleic acid amplification can be used for diagnosis. It is highly sensitive and non-invasive. The treatment is single dose of azithromycin, 1 gram. Alternative is 1 week course of doxycycline or fluoxetine, erythromycin, and amoxicillin. So other antibiotics that can be used in chlamydia infection: doxycycline or fluoxetine, erythromycin, and amoxicillin. Okay, dengue fever. This is caused by flavivirus transmitted by mosquitoes. It is endemic in Africa and South America. It will present with flu-like symptoms, myalgia, back pain, fever. There will be acute phase 3 to 4 days. It includes deep jaundice, fever, DIC, acute renal failure, and there is bradycardia, relative bradycardia. If we compare it to dengue fever, there is a rash, and jaundice is not common. If we compare it to Ebola virus, there will be respiratory and cardiovascular symptoms and also rash. So dengue and Ebola virus will have rash, but this yellow fever, it doesn't include rash. Mainly jaundice and DIC and acute renal failure. Causes of impetigo: Staph aureus, which is the most common, and the less commonly Streptococcus pyogenes. Regarding varicella zoster, when the patient will be non-infective if all lesions are crusted and dried. Regarding hepatitis B treatment, we will consider treatment if the patient have hepatitis B viral DNA load or hepatitis B E antigen, which indicated infectivity, or all this together: hepatitis B virus DNA load and hepatitis B E antigen and hepatitis B S antigen with the linked liver function test, and chronic hepatitis on biopsy. So what can we give? We can give interferon. What are the contraindications for interferon? Pregnancy, severe depression, ascites, and decompensated liver disease. The aim of treatment is to eradicate hepatitis E antigen and hepatitis viral DNA load to be decreased to reduce inflammatory necrosis of hepatocytes. Cryptococcus neoformis infection present in HIV patient with insidious onset of meningoencephalitis. Symptoms: CT finding, it is non-specific. Treatment with amphotericin B and flu with or without flucytosine, and after that in HIV patient we will have prolonged course of fluconazole. So the treatment of Cryptococcus neoformis, amphotericin B plus or without flucytosine, and prolonged course of fluconazole after that. If the cause is toxoplasmosis, then it will present with focal neurological signs and also ring-enhancing lesion. Ciprofloxacin can be used for chemoprophylaxis of meningitis, and in pregnant lady we can use ceftriaxone. Regarding diphtheria, the history will be suggestive that the patient visited area which is still endemic with diphtheria, like Eastern Europe, India, something like that. He will present with sore throat, swelling, pyrexia, pseudomembrane over the pharynx, the typical pull neck appearance, which is enlarged cervical lymph nodes. So the differential diagnosis is infectious mononucleosis. but exudate is more severe in diphtheria. Complication, this can cause cardiomyopathy and myocarditis. So myocardium and cardiomyopathy will be involved, cardiomyopathy and myocarditis. This will occur within 10 to 14 days of onset. Thrombocytopenia, nephritis, proteinuria also may occur. We should commence the antitoxin within 48 hours. Antibiotic also, IV penicillin should be used, and tracheostomy in cases of respiratory obstruction.